Welcome to the Dementia-Friendly Business Training for the general public. This training is provided by Age Guide Northeastern Illinois. Prior to this training, you should have taken the training module, Understanding the Basics. The purpose of this training module is to provide you with some additional knowledge on how to be dementia-friendly. The objectives for this training module are to review dementia, discuss how to build trust and rapport, and describe some communication strategies. To start, we are going to go over some background knowledge of dementia. You have already seen this in the previous training module, so this will be a quick review. Remember that dementia is a general umbrella term for disorders that cause chronic impairment of the brain's mental process. It often affects an individual's memory, thinking, decision-making, and ability to perform everyday activities. There are many different types of dementia. The four most common types in order from most common to least are Alzheimer's disease, vascular dementia, dementia with Lewy bodies, and frontotemporal dementia. In addition, there is a type of dementia called mixed dementia, which occurs when an individual has more than one type of dementia. Again, you will have already seen this as well, so this is just another quick review. Symptoms and signs of dementia can often differ depending on the specific type of dementia. However, some common signs and symptoms include communication difficulties, wandering, losing things, frustration, repetition, poor judgment, unacceptable behavior, and confusion. Despite these symptoms, people with dementia are still a valuable contribution to their community, and they are still a person. This disease does not diminish that. As members of the general public, it is critical to build relationships with those living with dementia. In order to foster inclusivity within your community, work on building trust and rapport. People living with dementia want to feel safe physically and mentally, to be able to find their way around, to have access to their community, to maintain their social networks, to feel like they belong, and to be treated with respect. In addition, caregivers and families to people with dementia want this too. To build that trust and rapport, here are some communication strategies that you and anyone else in your community can easily implement. The first is to avoid talking past the person. Like I mentioned before, a person living with dementia is still a person. Therefore, it is important to treat them as such by introducing yourself, using their name to address them, facing them directly when conversing, and make eye contact with them. The next strategy is to be patient. When communicating, use simple sentences and always remember to speak clearly. When it is needed, do some additional explaining to them and always give them enough time to process and respond. Never try to rush them or pressure them to hurry. Lastly, be respectful. Ask for their permission when applicable. Treat them with dignity. Do not attempt to argue with them. If you do experience communication difficulties, let them know that you are trying your best to listen and understand. As you complete this training module, I encourage you all to view the additional resources in the PDF download on the Age Guide Learning Center or in the description below if you are watching on YouTube. These resources will aid you and your business in your efforts towards the dementia-friendly initiative. Please feel free to download, print, keep, and share the handouts. Thank you for your commitment and conscious effort in caring for people living with dementia in the communities that you serve. Upon completion, a follow-up letter, certificate, and dementia-friendly window cling can be provided to your business. Please share this training far and wide to the other colleagues and other organizations in your network.